We're very pleased to have you with us, both folks from North America, Africa, and Europe. We've got a super lineup for you today. One piece of housekeeping, given the large number of participants who we expect to take part, we will be muting everybody. And when we get to the question and answer portion, you'll want to type in your question into the chat box, or you can do so before, obviously, and I will read out the question to our two speakers who will respond, and then we'll move on to the next question. So in order to keep things organized and functioning smoothly, the only way really for you to speak will be through the chat box. So with that, I'll remind folks again where they are in case you might be in the wrong place. This is the Center for International Private Enterprises series on COVID-19 and corruption. My name is Frank Brown. I'm the head of the Anti-Corruption and Governance Center at CIPE. And I'd like to turn it over now to Andrew Wilson, CIPE's Executive Director, for a few opening remarks. Thank you.
Thank you, Frank. And on behalf of CIPE, I'd like to welcome you to this, our first event in the Accountability in Africa COVID-19 Response Series. As Frank's already mentioned, this is part of a larger series that is being organized by our Anti-Corruption and Governance Center of Excellence at CIPE. You know, as the international community begins to turn its attention to Africa and some of the world's most vulnerable nations, this is a really fitting time to hear about the corruption landscape there and how organizations like CIPE are preparing to support local partners as they endeavor to both monitor and reduce levels of corruption. You know, and I can't think of anyone better positioned to speak on this topic from CIPE than our program officer, Lola Adekanye, who heads up CIPE's anti-corruption operation on the continent. With a partner network in 16 countries, Lola is receiving constant updates on the evolving situation, and she's going to share them with us today. And then after Lola, we'll be hearing from Gyude Moore, a former Liberian official who helped that country battle Ebola and is now working with several African countries to procure supplies related to COVID-19 crisis. That's all I'm going to say because I'd rather hear from our speakers and from Frank. So Frank, I'm going to turn it back over to you to moderate the discussion as we move forward. Thank you very much.
Thank you, Andrew. And with that, we'll turn it over to Lola.
Thank you, Andrew, and thank you, Frank. It's great to be here with everyone in this virtual conference. Thank you all for attending and being on time too. So I have a short presentation that will sort of highlight some of the things that we have been worrying about and thinking about, and also, you know, some of the successes, the lessons and opportunities that we are observing as we interact with our partners and try to find ways to support our partners and the extended business community in all the countries across the continent where we work. So Frank, if you don't mind, could you hit the agenda slide, and I'll just, you know, we will start talking about, I'll just run through this quickly. We'll start talking about just the overview in the context of what the current situation is right now in terms of the infection rates. And then we'll talk about Africa's readiness. Since we're talking about accountability and corruption in an emergency, and currently the emergency is the COVID-19 response, it's fitting that we talk about Africa's readiness to respond to the COVID-19 emergency. And then also during this emergency, of course, when there's pressure with any system, as such as this one, the corruption problems are, you know, they spike. You know, the risk of corruption spikes. And so we'll start to talk about that and then talk about best practices and opportunities to keep government officials, keep the private sector, keep CSOs accountable, and figure out how we can have better governance going forward. So if you hit the next slide for me, Frank, I'm sure many of you are keeping your eyes on these numbers around the world. And so this is a picture of what the current situation is like around the world. In the US, where, you know, everyone is very interested in what's happening, and we're focused there. We're focused on China, and that's Africa right at the bottom there. And you know, the numbers that you see in Africa, the total number that you see, is not half of what you see worldwide. This is an exponential increasing graph. So we just have under 16,000 infection cases reported across 52 countries in Africa. And the death numbers is under 900 people. Recovery rates is quite, promising too, or encouraging across the continent. And so what you will see is for Africa, where there are very many densely populated cities, you're not seeing very rapid spread in the infection rate. So if you hit the next slides, maybe we should talk about quickly what preventive measures and how quickly African governments responded with these preventive measures. So the World Health Organization announced on the 30th of January that we had a pandemic on our hands in the world. And fairly quickly after that, compared to other countries in the world, African governments started to introduce measures to stop the spread, to stem the spread, to slow down the spread and contain the spread in many African countries. It started with, I think it was Ghana or Nigeria, or in a sequence. Ethiopia also started to close its borders, South Africa, and then many other countries started to respond across the continent. And so as of March 28th, that's what the flight tracker, one of the flight trackers, FlightAware, one of the other ones, that's what it looked like in terms of flights operating into and out of Africa. All flights were stopped coming from many countries, especially countries where there were high levels of infection. Over 200 people were infected. And many countries started putting in place social distancing policies, suspending regular or curtailing regular activities. Then you started to see lockdowns by the end of March. You started to see lockdowns in major cities: Lagos, Johannesburg, Kenya, Nairobi, Accra. And in some countries, these lockdowns extended throughout the nation. And so, in a way, these responses, and this doesn't leave out government policies also, businesses and business coalitions started to respond also, CSOs. In Nigeria, the coalition is called CAR COVID. It's a coalition of businessmen who've contributed at least more than $63 million to the COVID relief fund. You're seeing, more civil society activity to support low-income population in Kenya. You're seeing that in Nigeria. You're seeing that in Gambia. In a way, this is not characteristic of African governments to be very proactive. I dare say that many of us observing are quite happy or quite surprised by the fact that many African governments responded really fast to, sort of proactively to this. And that probably affected slowed down the spread of the virus because they started contact tracing and testing. However, we still have these questions around what that means for the future. So, Frank, if you hit the next slide, please. So we know that, there's been a lot of preventive measures. There's been a lot of efforts, a lot of coordination with the Africa Center for Diseases, CDC, disease control. But at the same time, we also know that there are lots of challenges. Even with all of those efforts, there are lots of challenges with implementing those measures. For instance, the social distancing and the hygiene policy or measures introduced in many countries, they, at least in the urban areas in Johannesburg, in Lagos, they are significantly undermined, particularly because we know that a lot of Africa, at least 60% of the African population, according to the United Nations Habitat Report, live in very poor conditions, in what you would call slums. And so what that's characteristics of is no running water. It's no running water in most cases, or a central place to get water that's not sanitized or sanitary. You have very high levels of crowding. You also have a population that cannot afford to go to the hospital if they are sick. a lot of the times. We also, can't overstate the fact that because of the long-standing bureaucratic corruption problems in many African countries, many countries' government reserves are depleted. In a time of emergency, that's what governments, turn to. And a CNBC Africa analyst, did some work on this and found that many sub-Saharan Africa will need about 150 billion US dollars for COVID response, both for healthcare response and to keep the economy afloat while there's this emergency, and there's really no economic activity, very little economic activity in the country, on the continent. Now, the problem with that is many African countries don't have the capacity to take on much more debt. And this is even though the debt to GDP ratio for most African, the aggregate debt to GDP ratio for sub-Saharan African countries works out to something about 49%, which is not ridiculously high. But still, there's just no capacity for financial capacity for African countries to take on more debt. So you're seeing many countries struggling to raise funds from the business community. And fortunately, many donor organizations, financial institutions are looking to help in this regard. We also cannot discount the fact that the healthcare, sector, healthcare workers are mostly underpaid, or if they're paid, there are also quite few healthcare workers compared to the population. So there was a World Health Organization report from 2013 that suggests that there's one doctor per 5,000 people, and this is aggregate numbers in sub-Saharan Africa. And so finally, another thing that's quite nuanced, but we would recognize, is also there's a very, very depleted or battered trust in the government's capacity to take care of the citizens in Africa. Many of the countries, the cities where there's a lockdown, Lagos, for example, Johannesburg, we've seen civil unrest in the last week, and in the last 2 weeks, we've seen high levels of criminal activity. Unfortunately, we've also seen police brutality, probably in response to this, but more police brutality than usual. You've seen non-compliance with or cooperation with healthcare directives by citizens, sometimes businesses. There's a good example in South Africa. And so with all of these challenges, what keeps us up at night? Frank, you can hit the next slide. What keeps us up, worrying about all the anti-corruption and democratic gains that we've made in Africa over time? We see how, many African countries have responded, but we still have challenges in terms of being ready to respond and ready for the recovery. And so, to summarize this, I think what keeps us up at night really are the, problems of transparency that we would, increase during an emergency and probably not get better after the emergency. There would also be less, effort. So, institutions will not prioritize accountability of government officials and the use of public funds during the emergency. And there's also going to be an increase. We've already started to see an increase in opportunistic and unethical conduct by both public sector actors and private sector actors. Next slide, Frank, please. So just, to talk about some of the transparency concerns that we're seeing during an emergency, or during this emergency. At least in Nigeria especially, we're seeing that also in Ethiopia, there's limited, civic space. And that's understandable. Civil society organizations are not able to, engage with the government as much as they would. A lot of the relief funds coming into the countries, you might have heard about the Jack Ma Foundation donation, which was to come through Ethiopia to about 10 countries. You hear about the COVID Coalition Fund that's being collected by the Central Bank of Nigeria, relief funds in Kenya that the government has promised. It's only in Gambia that we've really heard about a civil society organization working to track a $10 million fund that's come to the government, or to make sure that those funds get to the people that they're earmarked for. In in Nigeria, I was speaking with a colleague from Accountability Lab who's looking to, reach out to the CBN to sort of, get involved in ensuring that there's transparency in how these funds get disbursed. But right now, civil society organizations are not in that position that they were in before, when they could move around and when they could engage with the press. That's the case also with the press. And so we also have that problem with procurement and reporting. Just a few weeks ago, last week, the Nigerian Medical Association Council, cried out to ask for healthcare information or information about the cases that are in Nigeria, just to be able to contribute to the knowledge base of the epidemiology efforts. And it's not clear. It might be clear why some information around financial relief coming to the countries may be hoarded, but it's not clear why that would be the case for healthcare information. And so, transparency has not been something that we've gotten right in many African countries for a long time. And so this emergency just reminds us about how important it is to continue to talk about that. Okay, so next slide, Frank. I'm staying on track because we have 20 minutes to talk about this, and I'll hand over to Gyude, and we will take more questions, and we'll take some questions and discussions. So accountability, this is another thing that we worry about. The public finance management systems in most African countries, I struggle to find an exception. It has not been the best. There's been a lot of problems with just access to information to start with. It's great that we had a few more countries in the last 5 years pass Freedom of Information Acts. Some of them introduced procedures for civil society and citizens to use those Freedom of Information processes to obtain information. But even in Nigeria, where we seem to have had the FOIA pass for a long time and have very active civil society organizations using the FOIA, towards the end of last year, we had about 11 states still not publish anything about their budget. We still have problems with access to this information to make sure that we can hold government officials accountable and ensure that there's accountability in the procurement and public spending systems. So we have those accountability mechanisms which are not the best during peace times, but during an emergency where governments have to spend quickly, where governments have to coordinate fast with suppliers, with healthcare officials, often these procurement processes and all the signatures you need for procurement, sometimes they could be overlooked, right? And there are no procurement provisions for an emergency situation in most countries. Now, we do have some emergency regulations passed, allowing some governments to bypass regular procurement systems, but those don't create opportunity for scrutiny by citizens. You also have now, high levels of extortion you have more opportunities for extortion in the healthcare sector and in the law enforcement space. There are a few examples we've been hearing about from our partners, but one example that comes to mind about how, just about how corruption in this context undermines healthcare efforts is in Nigeria, in a southwestern state in Nigeria that had not had an infection report for about 2 weeks in. Unfortunately, the first infection report they had was of a political elite who was able to get around quarantine. So he was allowed to stay in a non-isolated center and unfortunately infected scores of people before he eventually died, and leaving many people infected and now having to be moved to the isolation center. You have law enforcement officers also say, similar situation where, there are reports, there was a Sahara reporters undercover reporting about, the police, the police and law enforcement being very prone to extortion, being a, safe haven for extortion of different kinds. And this is corroborated by, several surveys that have been done in Kenya and in Nigeria. There was a survey conducted by the Ethics and Anti-Corruption Commission in I believe that was 2017, looking at corruption in different sectors in Kenya. And they interestingly found the health sector and law enforcement were like top 5 of the most corrupt sectors in the country. And so you have, healthcare officials having to make these decisions when political elites might be trading influence, might be abusing the authority and requiring that they don't stay in quarantine. Or you have people moving around, as we've seen in Lagos, people moving around in public vehicles, driven or guarded by police officers without permit, without authorization to do so, and thereby risking the spread of the virus if these people have not been properly checked. And it's one thing to have weak accountability mechanisms in the law enforcement space, especially in Nigeria. I can certainly say for, and going by the survey that was done by the EACC in Kenya, you do have weak accountability mechanisms in quite a few African countries. We've also seen that happen in Johannesburg recently. I can talk about that later on. But one of the things that I think is important to also observe is that there is a weak accountability culture in many of these instances, and that's a result of the weak accountability mechanisms. The weak accountability culture allows political elite to get away with things like the diversion of public resources, even in critical times like this. One example would be in Zimbabwe, where the government renovated a hospital, a very good hospital, a center. Do you mind muting your mics if you've just joined us, just while we're on the call? Right, thank you. And the hospital was renovated for political elites to be treated during this COVID crisis, treated of COVID-19 during this crisis. And it's the sort of thing, the great thing about that is a civil society organization took this case to court and was able to get judgment within a few weeks, was able to get judgment against the government. And so, that hospital is open to the public, which is great. But you have other kinds of abuse, like, the one I talked about in a southwestern state in Nigeria, where political elites get away with not being quarantined, not obeying healthcare directives. Another thing you tend to see is diversion of critical healthcare resources, right? An ex-core member, executive member of the NMA, really complained about the fact that, government hospitals don't have access to protective equipment, but then almost all politicians in the country, government officers have like the best N95 masks, or have like the best PPEs, even though they don't need them. And so, we're worried about what happens when the accountability mechanisms are weak, but the culture also is such that citizens suffer, or the healthcare efforts of the healthcare officials is undermined because there's this very weak accountability culture. And of course, we'll come to what we can do about it and what we are doing about it. If you hit the next slide, I'll just talk about the opportunistic unethical conducts that we're seeing also, which sometimes also relates to the accountability culture. But in the public and in the private sector, you find that there's opportunity for, when you talk about corruption, there's a dotted line to human rights abuse. There's opportunity for law enforcement officers to abuse their authority. There's been cases in Nigeria where, unfortunately, a gentleman was beaten to death in the south region of Nigeria, even when, there was no federal lockdown in that part of the country, but he just wasn't supposed to be moving around. You have cases in Lagos. You have a case in Lagos where a trader who was moving around during the lockdown had all of his goods, and he was conveying his goods to God knows where, probably to his house, God knows where. But all of those goods were seized, right? He wasn't written up in a ticket or anything. All of his goods, his food supplies that, are very hard to come by these days, were seized. And so you have cases like that. You have cases in South Africa where police officer beat a gentleman to death for violating the lockdown orders. And whether there will be, consequences for these law enforcement officers, it's hard to tell. But at least for 2 of these cases, it's reported that there's some investigation going on. And you also see, because of course, with the reduced press freedom in parts of Nigeria where it's freelance press that can get, information about what's happening in those parts of Nigeria, especially like in the northern parts of Nigeria. Same with Cameroon, even where there has been a suspension of hostilities so that people can get treated, right? But because of that, it increases when just like, the Washington Post slogan says, when there's no light, when there's no attention, it increases opportunistic unethical conduct that you shudder to imagine. And of course, diversion of or misuse of donor-provided healthcare relief and also economic relief becomes a great risk. For private sector, we have actually seen some price gouging, not only of healthcare supplies, but of like food, cleaning supplies in some cases. And side by side with the innovation of many SMEs are learning to, quickly fill up this space, make soaps, make hand sanitizers and things like that, which is great. But you also see, the sale of these unapproved healthcare supplies, sometimes even medication without prescription in many of these countries. And there was a case of a young man, and his family, his wife and his kid, who overdosed on chloroquine because of the news that it was used to treat the coronavirus, COVID-19 infection, and unfortunately died. So you're seeing these things happen. You're seeing violation of government directives. In South Africa, there was a factory that locked up its employees to continue to produce, not healthcare resources, just manufacture the goods that they do, hoping that they can sell these goods during the recovery. And so these are the sorts of, unethical, these and many more are the sorts of unethical conduct that you see during an emergency. And that's, those are the kinds of things that can fall through the gaps because of weak accountability systems, even more during an emergency. Now, enough of all of these challenges and, problems that we're experiencing. What we are also seeing alongside this is so many civil society organizations, many CIPE partners as well, professional organizations stepping up and showing us some best practices to learn from during an emergency. So yes, Frank, you can hit the next slide. And just these are a few. I have about 4 of these on these slides, and of course there are many more. I'm looking forward to hearing many more from you all and from Gyude. But these are some of the things that we suggest as best practices and also opportunities to ensure accountability and better governance during and after the COVID-19 emergency. One of the first thing we encourage our partners to do, and many of our partners are doing, and many other organizations that you work with are probably doing, including yours, is continue working safely to the extent possible. To keep offering service and to retain employees as much as possible. And so we see this happening with all our partners, with many of our partners in the Africa Anti-Corruption Compliance Network, as well as chambers that we work with. Repurpose resources to support relief efforts. We've seen this happen in Kenya. You'll get the slides, so it's good to go and have a look at these. I want to save more time for the conversations. If you hit the next slide, Frank, I'll quickly talk about some of the other things that we recommend as best practices. And so, so in addition to continuing to work, in addition to repurposing resources as much as possible to help during the COVID-19 crisis, if it's possible to do that, as we've seen in Kenya, some of our partners, partner Chamber of Commerce members, repurposing resources to make soaps and sanitizers and masks, and trying to get the regulatory approval to distribute these. We would also recommend that you continue advocacy and provide alternative policy solutions to government. The Kenya Private Sector Alliance, one of CIPE partners also in Kenya, has done proposed economic crisis response strategy for the government during short-term responses and long-term responses. And this is all with inputs from the private sector broadly. And very important, start to plan for recovery, start planning for recovery. Lots of things to do while you plan for recovery. I'll let Gyude talk more about those, but first, learn from the experience. Learn from experience, learn from the current experience, learn from previous experience in countries where the Ebola epidemic happened, and also prepare, start now to prepare to hold public sector and private sector stakeholders accountable. So I'll hand it off to Gyude now, and please feel free to type your questions in the comment box and submit them now or later on. And Gyude, please go ahead.
Thank you, Lola. And thanks again to everybody. Great to be here. I like how Lola kept saying, and I'll leave that to Gyude to say that. I'll leave that. So no pressure. So I wanted to start my remarks by repeating this phrase. I think most people who have followed politics have heard this before. And Rahm Emanuel made it popular when he was chief of staff to President Obama that you never let a good crisis go to waste. And normally it's used in a positive way, is that government policy or programs that would have been inconceivable in normal times, somehow during crises, it becomes an opportunity for you to be able to enact those policies or put them into practice, because people are more willing to accept these in emergencies than they are in regular times. But I think it goes both ways, that there are people who want to convert public resources to private use also see emergencies as an opportunity, and they would not let a good crisis go to waste. And the opportunities for this abound during an emergency. First, because when governments declare a state of emergency, they suspend normal rules. And we're talking about context in which the existing rules are barely enforced or not regularly enforced in good times. The suspension of those rules in emergencies then open up the opportunity for possible waste and fraud. Part of this is simply because you have an emergency, it doesn't suspend the society as it is. So for example, South Koreans went to the polls this week, elections still went on. And Ethiopia has postponed the elections, but elections are still going to go on. When we responded to Ebola, we had senatorial elections that year. So for people who are in government position, who are looking to run for government office, or some people are coming to the end of their time in government, we were in the second and final term of our time in office. And most people leaving office do not have the economic certainty and stability that normally is associated with, there's no pension for, say for me as a former minister of government, there was no pension for me. So in a crisis like this where the rules become lax and I know my time in office is coming to an end, or I know I'm going into an election, using the emergency as an opportunity to be able to benefit myself becomes pretty easier. And because we've suspended normal rules, then the possibility of people being caught doing this becomes really hard. And the reason I'm stressing this is because COVID-19 is in many ways like the Ebola outbreak was in 2014, but in other ways, and very important ways, very dissimilar. So the 2014 Ebola outbreak was a localized affair, where so it was Liberia, Sierra Leone, and Guinea, a single index case in Nigeria with about 29 infections, and then in Senegal. And because of that, because the outbreak was localized, we could expect and we got significant assistance from everywhere else in the world, right? Because you could help these three countries that were faced with it. Unfortunately for us in these times is that because it is a global pandemic, it is happening everywhere, and some of the highest numbers are outside the continent of Africa. The places we looked in the past for assistance may not be available, that assistance may not be available, and even if it were available, it is not going to be at the same, in terms of how substantial as it was during that time. So it's really, really important now across the continent that every dollar that is being spent for the response goes to that, because that's how we're going to be able to do this. beyond the fact that we may not be able to get significant assistance from external partners, there's also the fact that there's been a significant loss of demand for the products that African countries depend on for revenues. And so there's a significant decrease in government revenues. At exactly the same moment, there's increase in extra budgetary expenses because of the outbreak. And so because of that, we want to pay attention to what limited resources we do have, that those resources are being used as best as we possibly can against this. So in Liberia, we faced the same problem. We were overwhelmed. As a small country, it was a post-conflict country. It was returning from war. And even in normal times, there were always accusations of corruption. And now we had declared a state of emergency and we needed to purchase large quantities of stuff. And initially, even with the incident management system, there were accusations of corruption in terms of monies and material being redirected or being repurposed for private purposes. And so one of the things that we did to help us with ours, and I think it's important to be able to understand here that unless a country has actually gone through this and retained the institutional memory, most of the countries in Africa are going to have to relearn the lessons that their counterparts learned in 2014. And there are a lot of mistakes up front, right? And there's a learning curve. So our first response wasn't at best. For example, we attempted forcibly quarantining people in a slum community and in geographic areas in the country. It led to a social unrest, and a young boy was killed by the military. So the government itself made those kinds of mistakes. And so in terms of our procurement, in terms of the allocation of resources during the outbreak, what we did then was we created something called the Ebola Response Center. And the Ebola Response Center was separate from the incident management system. The incident management system were the healthcare professionals who were responding directly to the health crisis. The Ebola Response Center then took over things like logistics, took over things like procurement. So then by separating the people who were doing the health response from people who were doing logistics, we took away the incentive from the health response people from diverting those things in ways. And because the people handling logistics could not move logistics around without a requisition from the health team, it didn't make it impossible for people to divert resources, but it made it difficult and made it easier for it to be seen. And then after the entire process itself was still subject to the General Auditing Commission. So at the end of the Ebola outbreak, there was an audit of the entire process. So because people knew the process would be audited, and because the process was separate in such a way that it balanced out each other, we ensured that most of the resources that were dedicated to the outbreak went to the outbreak. I think it's really, really important that simply because we're in an emergency doesn't mean we suspend all of the rules. There are still ways to keep those rules functional. And if a small country like Liberia that had limited in terms of the capacity of the state could achieve this, I think bigger countries should be in a better position to be able to. And every other small country that's facing the same thing we are should be able to do that. The second thing also is that there has been in the past, especially around public health, demolition of market stalls, use of the state security to enforce public health measures. This is very, very common across the continent, and it needn't be. I don't know why this happens. I have a speculation, and my speculation is simply that in most countries in sub-Saharan Africa, there hasn't been a deep repository of trust and social capital between the government and people. So for example, when people see soldiers across the continent, most times it inspires fear. People don't see soldiers and think, oh, they're here to help. And so because the governments do not have this social capital built up over time, to use in the case of an emergency, the best way governments can get people to comply during emergencies is the use of force. But again, we found this out in Liberia that using force to do this, because over the length of the outbreak, we're not going to have a medical countermeasure. So you're going to depend on people's behavior change to be able to break transmission chain and slow the transmission. So you need the cooperation of the people. And until the response becomes community-centric, the use of force simply makes it harder for you to be able to achieve what you're trying to do. So our involvement, our response in Liberia needed to evolve, because in certain communities, the government isn't just as credible, they're partners in this community. So I think one of the things that happened then was the incident management system. That is the response, the people more directly responding to the outbreak, incorporated civil society organizations and non-governmental organizations. And so because it wasn't simply state-centric, it brought on people who were more critical of the government, people who were trying to hold the government accountable. And I think one of the recommendations that I've made across is that what we're seeing across the continent at the moment is just state-centric responses. Everything is being done by the government. Everything is being done by the government. And it just, for the long term and the long-term viability of the policy in terms of response to this, if it doesn't become community-centric, if civil society organizations are not brought into the incident management, if compliance with public health measures is not, if local communities and local leadership are not incorporated into the response, is going to be very, very difficult, and we're going to see all of the waste that we're talking about. The final thing is, as we begin to transition into recovery, as we begin to transition into, and one of the things I've been recommending is that the total shutdowns, the total closures that we've been seeing may not be feasible and actually arguably counterproductive. If you're going to make any adjustments then to maybe sort of like a staggered access to public space, you're going to need the community, and you're going to need the people who may not necessarily always agree with the government. You might need people who at times are critical of the government. Those people are going to be necessary for the long term. And so I think what is important for us, for our partners, for civil society organizations on the continent, is simply because there is an emergency, it doesn't mean that we have to suspend the rules. These rules are difficult to maintain in normal times and might be even more difficult now in these times, but it is necessary to be able to make the kinds of adjustments that ensure that scarce resources are allocated properly and governments remain accountable to the people who they're supposedly protecting from the health crisis. I'm open to questions, and again, thanks for having me on here today. Frank?
Gyude, thank you so much. And Lola, thank you as well. I think your experience on the ground, whether it's Lola sitting in Lagos and in daily touch with our 16 anti-corruption partners in 16 different countries throughout the continent, or Gyude, your sort of hands-on experience back in 2014 and now as well, have really shown through in both your presentations. Before we get to questions, and I thank folks who've already been writing in, a quick commercial break to let people know that if you would like to stay up to date on COVID-19 and corruption issues, be sure to follow our Twitter feed. You see it there at @_ACGC. If you would like to be more involved in our COVID-19 and corruption activities, or you would like to be included on our COVID-19 and corruption WhatsApp channel featuring news every day, just drop us a line at that email address, acgc@cipe.org. So with that, I'll get out of the way and read the first question, which goes to Gyude from Abdu Al-Kepsi, who heads up the, he's head of programs at CIPE. He's my boss. And so I'm giving him the first question, which is, Gyude, what can international organizations like CIPE do to help?
I think you're doing that right now. I think, forums like the one you just hosted are really, really important. I mean, to let people, to let my counterparts, people who are doing what I did before, and people who are in government who are executing these programs, to know that, you know, simply because there is an emergency doesn't mean that people aren't watching, that people continue to watch. But most importantly, I think empowering your local partners. because there's only so much that you can do and external organizations can do. There are local civil society organizations that are focused on transparency and focused on anti-corruption effort, and what support you can provide for them, what lessons from other places you can provide for them, what connections you can make between them and others who are doing better in other countries, providing them a platform for them to be able to learn from each other and train each and exchange ideas. I think those are going to be really, really important. But just simply because there is a health emergency outbreak doesn't mean that the work that CIPE and organizations like you do, that simply there's no way to continue to do that work. I think just continuing to do what you did in normal times, recognizing that your work might be even more important now than they would be in ordinary times.
Thank you, Gyude. That's a good answer. And I think sort of underscores the degree to which we are seeking to provide a platform for folks to convene on this issue and to bring people together to find solutions. Another question, Gyude, for you from Blair Glencourse, who's the founder and head of Accountability Lab. It's a rather technical question, so I'll read it quite slowly. So you mentioned that the ex post audit, you mentioned the ex post audit in Liberia, but in the end, very little of Liberia's Ebola funding was audited. And that funding that was audited showed significant graft. Do ex post audits really act as a disincentive when it is clear they won't be feasible?
So first one, you know how you go into a department store and they have a bunch of cameras, and those cameras are meant to deter shoplifting, and to a certain extent they do. But that doesn't prevent everybody from shoplifting. People still steal, and so that's why department stores will have security guards, and will at the front end, and they still have magnetized readers to be able to track things that have been taken out or hadn't been paid for. So simply because one has, it's the same thing. Just because we have traffic lights, it doesn't mean that people don't run the traffic lights and we don't have accidents. Simply because you have these things in place do not necessarily mean it completely removes it, but to a certain extent, it serves as deterrence. So I think just because of deterrent function, I think it should be there. That's one. Number two, the second reason why this is really, really important also is that sometimes the government in power may not act on the recommendations of the auditor, simply because the government is trying to protect itself, protect its own name. But as long as that audit is on the record, it doesn't mean that the administration coming after that may not do so. What we saw in Liberia is at the end of our administration, there was supposedly an asset recovery team that the new administration established, and they're doing investigations. So simply because the administration that implemented the response and then did the audit did not act on the recommendations of the auditor does not mean that those recommendations will not be acted on by the administration coming after that. But I don't think because it didn't completely stop people from being corrupt, it didn't completely prevent that we should completely stop that. I think building institutions and institutions actually take time to become rooted. So I believe it's an excellent way to go forward with this.
Thank you. So next we have a question for both of you. Lola, I'll let you go first to give Gyude a bit of a rest. This question comes from Jennifer Lewis from USAID. And she says, thank you for this great conversation. It is wonderful to see Africa in many ways leading in this space. How much of this is due to lessons learned from Ebola, both in terms of accountability, audits, etc., and in terms of responsiveness from government and communities? What can we take from this to use elsewhere? Lola?
Hey, yes, thank you, Frank. That's a great question. Thank you, Jennifer. So I just, in terms of just general preparedness for a healthcare pandemic like this, I see how at least Nigeria, so a few countries were hit by the Ebola epidemic. Nigeria was one of them, Liberia, Sierra Leone, the DRC, just a few countries compared to 52 right now that we have across the continent. But the good thing with that is, or what the lessons learned from that, the good thing is the lessons learned from that has been adopted throughout the continent to a large extent. So, you know, you have the Africa Centers for Diseases Control, which, you know, ramped up its capacity to support CDCs across the continent since the Ebola epidemic. And so there's greater coordination now, you'll see, across the continent. You'll find governments are more responsive than, you know, than at least to some extent they were during the Ebola epidemic. It took a very long time for governments to start doing testings, you know, at the borders. In Nigeria, the testing started just about a few days before the first case. Actually, not the testings, the screenings. But even when the first case was caught, it took a while to eventually, you know, confirm that it was an Ebola case. But when you with the Covid-19, the response was much swifter. So I think that, you know, the early response is one thing that countries have learned. The contact tracing expertise also has improved. You know, there's only been one real epidemic in my lifetime. So I can see how, with the ACDC doing some new training for public health officials, I can see how health workers are now becoming more skilled in managing epidemics like this. So that has helped. In terms of accountability, you know, the World Bank, I think the World Bank did an audit. I think that's the audit you're referring to, Gyude, that found about a third of the donor funds were unaccounted for. Not sure if they got lost due to corruption, but at least they were unaccounted for, right? And, you know, since that audit, one of the things we can tell our partners to do is to continue to prepare for the chance that they will be able to audit the use of donor funds right now. And so it's not easy to tell how much impact that would have, but it's, you know, it's definitely the sort of thing where if you know you're being watched, you will be a little less, you know, careless about spending. You know, if the government knows they're being watched or knows that an audit will come after the epidemic, or that there's scrutiny from the civil society organizations, they'll be more inclined to properly recording what funds go out, where they go to. There's no way to measure now whether that's changed, whether you know, their behavior has changed in the places where, in Kenya, for instance, we're talking with our partner about notifying local county officials in some counties that the relief funds coming to their counties would be audited or scrutinized in some ways. And we're seeing our partner doing that in Gambia, one of our partners doing that in Gambia. It's not easy to tell what impact that would have, but it certainly would have some impact compared to places where there's no anticipation by the government that some audits would come after this. And so we are inclined to continue to support our partners, hopefully to audit some of the spending of these relief funds to make sure that there's some accountability. And I think finally, the other important thing and lesson that many parts of the world have, I guess, already learned is keep making sure that the accountability networks that have been created in these countries remain and continue to work. And they should be across diverse civil society organizations. And so you have civil society organizations that work on accountability and transparency issues in one silo, and then you have chambers of commerce that have the same interest in, you know, anti-corruption and transparency from the government and accountability, working in a different silo. But in Kenya, one of the things we're trying to do is make these civil society organizations work outside of silos in networks so that they can jointly put the pressure of citizenry on the government to make sure that there's transparency and accountability in how county or public funds are being used and disbursed, and just making sure that the resources get to the people that need them. And so in working in these networks, they're able to, you know, create the sort of political relevance that gets the government's attention. In some countries, it'll not be easy to hold government accountable because government is not that responsive and eager to engage. And so the stronger you can make the citizen civil society's voice, the better. And the way to make the voice of the civil society strong is to build coalitions across civil society, professional associations, chambers of commerce, to be able to get this kind of scrutiny, this kind of opportunity to scrutinize government funds. And that's something we're learning in Nigeria, we're learning that in Kenya, and we're taking that to all the other countries that we work in. So yeah, I'll let you, Frank, decide if I left enough time for Gyude.
Maybe not. So maybe what I'll do is I'll combine this question with the next one, which is specifically for Gyude and touches on some of the same issues. So we've got about 35 more minutes left in this session. Again, if you want to submit a question, please use the chat box. Given the large number of folks on the call, I'll read out the question to whomever you address it to. So just use the chat box. So question for Gyude. This comes from Hanan and asks, what are some of the lessons learned to contain Ebola that Guinea, Liberia, and Sierra Leone could share with the rest of Africa? Has that type of dialogue taken place across governments to help deal with COVID? Thank you.
Yeah, so again, thanks. I think that's a really good question. So one of the first things I think the continent benefited from after Ebola was in 2016, the establishment of the Africa CDC to be able to coordinate with health departments across, health ministries across the continent in the case of health outbreaks like this. So I think that's one of the things. Secondly is WAHO, the West Africa Health Organization, that is sort of like the region's own version of the WHO that coordinates. Again, there's been a significant amount of information sharing across governments, across borders. And so that, again, is as a result of what happened during Ebola. I think a number of things. One, most African countries moved very aggressively and very quickly. I mean, Uganda shut down gatherings of more than 10 before they reported their first case and shut down the entire border after the first case was reported. Uganda has had some of the most stringent in terms of cases, but most of that experience is from Uganda's own experience with Ebola. And most countries around the continent saw what happened to the countries in West Africa during the Ebola outbreak. And so I think that was useful. In terms of what message or what lessons they can, I think it's really hard, but I think one of them was just that in responding to a health crisis like this, you have to over-prepare. And over-preparation means that at the end of the crisis, you want to be criticized for having done too much, not too little. And it's because of the speed at which your health systems can be overwhelmed and the speed at which everything can be shut down. And so because of the scale and speed, I think one of the things that we share with them is, you imagine the worst possible thing that could happen to your country, and that's what's going to happen, so prepare for that. And so our own preparedness in West Africa was based on previous experiences with Ebola elsewhere. And most of those experiences with Ebola were pretty rural and in small villages. What happened in West Africa was the first urban outbreak, and we were totally unprepared for the speed and scale at which it happened. And so I think one of the things, the most important lesson that we can give to our counterparts elsewhere is how fast this is going to be and how difficult it's going to be in terms of shutting down the system. I think finally, unfortunately, I don't think we shared this lesson well enough, or if we did, it wasn't learned. And that, using the use of force to enforce compliance is not optimal, and in the long run undermines the outreach. We've seen that in Uganda, in Rwanda, in South Africa, Nigeria, deaths by security forces. There was a man in South Africa who was shot after the police followed him from a bar to his house, and they shot him in his yard. He was already home. And so in Kenya, we've seen that the police, people breaking curfew on the first day and not even intentionally, were beaten by the police. And so I think one of the messages that we will give is that a response to a crisis of this kind it has to be community-based, and one in which the government antagonizes the community that's going to depend on will be really, really counterproductive in the long term.
Thank you, Gyude. That's quite helpful. And I'm going to move on to a question from GFI, which I'm assuming stands for Global Financial Integrity, an NGO based here in Washington with which we work from time to time. The question is, and this I'll hand off to you, Lola, given the fact that you and your colleague, Lars Benson, head of the Africa Department, work so hard on trying to reduce risk in a way that boosts trade. So it's a question really well suited to you. Again, from GFI, Question is, given that demand for African products is dropping off at the exact time more revenue is needed to address COVID-19, what can the international community do to help boost trade with African countries?
I think that's an interesting question, and that's one of the things. That's why we really talk about plan for recovery, because it just seems like expectedly everything is on hold. It seems like the government in Nigeria, I think in South Africa as well, published a few government agencies that would continue working during the lockdowns. And I was looking to see more, economic affairs related agencies, but there weren't that many. I think one of the things that could happen is active engagement with the Africa Union, where a lot of this dialogue is taking place. Because even during the lockdowns, while there was the emergency in many parts of the country, the continent, the AU was meeting and talking about how critical it would be for the Continental Free Trade Agreement to advance the conversations and the efforts to roll that out, to advance, during a recovery or towards the end of an emergency. So I think engaging with the African Union is really key. Quite a few organizations are already doing that. There are a few working groups. Our sister organization, the U.S. Chamber of Commerce, the Africa Business Council of the U.S. Chamber of Commerce had a webinar 2 weeks ago, and they had a readout about some of the conversations that they had at a meeting with the AU on the intellectual property side of things. I think there's so much opportunity in getting involved in the conversations on the CFTA at this time. At the same time, there are quite a few regional, multilateral bodies that are, looking at supporting regional trade, integrating trade in Africa quite, more efficiently. And I think that it's important to start looking at conversations with, the likes of COMESA, the likes of the ECOWAS. And why that's important is because, of course, a lot of the models that the, regional bodies have for streamlining, the regulations and reforms needed to advance the CFTA are being, adopted or reviewed, revised for the CFTA. But also beyond that is actually the fact that the high growth potential areas, the products, the market intelligence information would come from these, these sub-regional bodies. And that would help with proper, better decision making when, countries or governments are looking at expanding trade opportunities with African countries. And finally, I would talk about, the risk there are all kinds of risks associated with, doing business with Africa that many countries and businesses have, highlighted. And one of them is, of course, the risk of corruption, which is what we're talking about again today, right? But working with chambers of commerce, working with professional institutions in, 13 countries, CIPE is trying to, de-risk investments in Africa to the extent possible. And this is through an ethics first platform that CIPE is planning to roll out this year, which would help African businesses, mostly the small and the mid-sized, but also large African businesses, implement anti-corruption standards that, are benchmarked by international standards. And so that, further reduces the risk of, creating counterpart relationships with suppliers, with third parties, or even joint venture relationships with businesses on the continent, if companies are looking to set up shop in Africa. So those are the three things I think would be, priority during this time. Frank?
Yep. Thank you, Lola. That's great. And thank you for weaving together all the different programmatic elements of what we do at CIPE regarding this theme. So we've got about 25 minutes left, a bunch of questions to get through. So Gyude and Lola, as you answer the questions, if you could keep that in mind, because we'd like to try to get to everybody's questions. A reminder to those taking part in this is part of a series on COVID-19 and corruption. we'll have future installments devoted to South Asia and Eurasia. If you would like to receive information about COVID-19 and corruption, just drop us a line at the email on your screen, which is acgc@cipe.org. If you would like to follow us on Twitter, we are at CIPE_ACGC. So with that, I'll move on to the next question. It comes from Richard Crystal, an alumnus of our internship program at the Anti-Corruption and Governance Center, currently with the Transparency and Accountability Initiative. He asks, Lola, you mentioned that you've only seen civil society working to track COVID response funds in the Gambia and less so in other countries. How is the enabling environment different in the Gambia compared to other countries for this tracking work to happen? Is there anything preventing this work from happening in other countries? Is it governments withholding info on funding?
Great question, Richard, and a quick shout out to Richard, who came to intern in Lagos. Never been to Africa before. Great decision to do that on our anti-corruption program. Just a quick response to that. And, you know, this is largely speculative, but it certainly is quite connected. The Gambia has had what we call in the last, I think this happened in 2017, 2018, what we call a democratic opening. And we have a rapid response program that Frank does a hell of a job on leading when there's a democratic opening in a country. And a democratic opening basically is the sort of opportunity where a country that has had an authoritarian system or, you know, a non-democratic system operating for a long time suddenly has a leader who is proactive about reforms and proactive about liberalizing the economy and making it a democratic country. Gambia had that around 2018. So I would say, you know, the enabling environment in Gambia would be connected to its active civil society and, you know, political party engagement that led to the toppling of a dictator that had been president in Gambia for going on 3 decades. And after that, Gambia also had its parliament for the first time changed completely. So they had an election for legislative officers and changed more than 80% of legislative officers who had been in power for decades, breaking, you know, the oligarchic structures that the country has had for a long time. You know, the new government that had been, you know, part of a political opposition for many years, eventually formed a coalition to run against the former dictator, now is really prioritizing transparency. And that's what is important. It's helpful. The best environment for civil society is when a government prioritizes transparency and accountability. That's not often the case during an emergency in countries where maybe you don't have like a democratic opening like in the Gambia. But in the Gambia, these things come together. And I think that's what has created this kind of environment for the Gambia. But what's important is still for civil society and, you know, other citizen coalitions to work together in a network and continue to put pressure on the government. And that's what creates an enabling environment over time. So I think that these things, I'm speculating that these democratic openings and the fallout from that, you know, with the parliament changing so much to more proactive, regular citizens who have always wanted, you know, change in the Gambia, the combination of that and the fact that the new government really wants to be seen as being transparent, the country is trying to implement, to get, what's the word? To you know, apply the United Nations Anti-Corruption Compact, the UNCAC. I think it's an ascension to the UNCAC, and that requires a lot of work, including demonstrating civil society scrutiny on government funding and government actions and activity. And so that, I think, has created the enabling environment. But nevertheless, in other countries, I think civil society engagement across the board would be an important factor to create the enabling environment for governments to engage with CSOs in other countries.
Thank you, Lola. Now we've got a question for Gyude from Anna Kampanik, who heads up the global section of CIPE, and that's sort of CIPE's research and development unit, where a lot of the corruption programs that we currently run have had their origins. So Anna asks, this may not be a strictly anti-corruption themed question, but what were some of the key lessons from reopening the Liberian economy after the Ebola crisis? How can countries do that responsibly and hopefully also embed some good anti-corruption measures in the process? So Gyude, a question for you.
So I think listening to Governor Gavin Newsom last night, talking about some of the changes that people in California are going to see in their lives when the society begins to open, I think those were some of the things we saw, right? So almost every family, almost every home had a bucket out of front. And so when people came, before people entered the home, they had to wash their hands at those buckets. Public buildings had the same. There was temperature taken everywhere when you walked into buildings. So because in a way, even though Ebola was a deadlier disease, it was an easier one. People did not transmit the disease unless they were symptomatic. And by then, and the second thing also was that it took up to 21 days. So for us to open the society up, it was, we wait 21 days, and at the end of 21 days, if there are no cases, we declare the epidemic over. For us in West Africa, we decided to extend it to 42 days. And so we went 42 days, but within those 42 days, the society is opening up, right? And so there, you still kept the public health measures in place, some level of social distancing, some level of behavior change stayed in place. And I think that's what's going to happen here. Second thing also was that, and we haven't seen that here, but just maybe this is now how the system works here, was that the incident response was separated from normal healthcare, so that people could still go to the hospital for malaria, people with accidents could still go to the hospital without the fear of being infected with Ebola. So we created these Ebola treatment centers. So if a person had the symptoms or a person felt like they had Ebola, they went to an Ebola treatment center, they didn't go to a regular hospital. I think that's what's going to happen too, that we have specialized clinics to treat COVID-19 and keep our regular healthcare system functioning. And I think, finally, I think people should be willing, people should recognize that in the long term, that the economic recovery is going to be long. The economic impact of shutting down the economy, of being the economy being shut down, because first is even on the day, if the government opens up the economy and says, oh, people can go back, people do not necessarily go back into the places they were before. People are going to be afraid to go to restaurants. People are going to be afraid to go to ball games. And so the economy is going to take a while to pick up. And I think anticipating that and managing expectations is going to be important for that. I just quickly wanted to say something about what international partners can do in terms of the economy, because when this ends, Africa was already further behind in most regions of the world. And so the economic impact is going to be stronger on the continent. But over the last 60 years, the trade patterns between Africa and the rest of the world have been really ridiculous. So Africa has been primarily the source of raw materials, and the rest of the world sent finished products to Africa. There is no way that Africa ever develops enough if it's not able to add value. And so I think going forward, what international partners can do to help Africa along that line would be very, very important, especially after a pandemic like this. And from the look of things, it's not very promising, because the US is underway trying to negotiate a bilateral trade agreement with Kenya. At the exact moment, the entire continent of Africa is trying to build a continental free trade agreement. So the US isn't setting the best example here, and I hope other international partners will not follow the US's example.
Thank you, Gyude, and thank you for putting that in a sort of global geopolitical context as well. A question from Lawrence Sperling for you, Lola, touching on an issue that we are trying to expand on here at the Anti-Corruption and Governance Center, the link between human rights and corruption. So Lawrence asks, can you elaborate on the link between corruption and human rights abuses, and how can empowering local civil society help to reduce the risk of human rights abuses alongside corruption risks? That's to you, Lola.
That's a great question that I've also been thinking a lot about. It's during this emergency, it's becoming clearer to me on a very simple scale how that happens. But there's a very interesting paper I have to look for that, and more researchers are starting to connect the dots between corruption and poverty, and that's where I started to think about human rights. In many African countries, the rights of the less well-to-do, the low-income earners are not as valuable or as valued as the rights of the more well-to-do people with means and political elites in many parts of Africa. And during this emergency, I'm seeing that happen to become clearer, in the sense that you find that there's a lot of abuse of authority by law enforcement people, like police officers on the streets during an emergency, during elections, and these tend to happen in the lower income neighborhoods than in the higher income neighborhoods, right? And a lot of times when you interrogate, where there has been an abuse of authority, a young man gets beat up, there are special response groups that, pick up young boys because they are put together to fight armed robbery cases and criminal activity in these communities. You find them basically extorting these communities. And if they can't extort, I don't call it bribery, because they really take these monies from these people arrested in these parts of the country, almost at gunpoint, right? They have guns in their hands and they have a uniform, so they have the authority to scare people. So it's this demands of bribes that happens in situations where there is like an emergency, or where there is a strong directive for for law enforcement officers to keep the peace. And these police brutality cases tend to happen in those low-income neighborhoods. They're often connected with bribes or extortion. And the connection with low-income neighborhoods is really about the value of the human rights for people in low-income neighborhoods, juxtaposed or compared with the value of human rights for people in the higher income neighborhoods. In Lagos, there's a lot of criminal activity happening on the mainland, and then the high-income neighborhoods on the island, you're not yet hearing about that. And it's it speaks to the sort of things that at least I observe, and we observe in many countries around the world. So that's one very simple way that I see a connection between corruption and abuse of rights. Other ones would relate to companies or organizations violating the law at the expense of their employees sometimes. Or violating labor law, labor standards at the expense of their employees, or even violating the lockdown regulations, even at the expense of their employees. And they do this, by paying bribes or throwing around the name of the company, which may be a company owned by a political elite. And so that, gets them to move around during this period. There's a report now that the police is handling where a sub-national state official found police officers moving company people around against the government's order for lockdown. But they were moving them around, transporting them back and forth to work and everywhere else by police officers. Like, police officers were driving them around, and these are police officers who should be enforcing the lockdown. And so that's even at the expense of the health of the employees, in terms of them being exposed to the risk of infection. So there's more to this than that. I'm sure at the ACGC would explore quite a bit. But in terms of this emergency, it's coming together to me with regards to these simple abuse of authority that tends to involve abuse of human rights of especially low-income people. Civil society organizations tend to do a lot around this. They're doing a lot of awareness raising, creating platforms. I think there's a hackathon in Nigeria right now by, I think, 100 tech women trying to track some of these kinds of incidents. So raising awareness about the rights of the people to these people whose rights often get abused, and creating opportunities where they can report. There's a free due process access hotline that I've seen also that people who would not be able to afford lawyers ordinarily can call into. Those are the sorts of things. More pro bono legal support for low-income communities is one way that can really, really help hold government officials accountable when it comes to abuse of the rights of especially low-income people. High-income earners, not to say they don't need these protections, but often high-income earners can afford a lawyer, and that scares an average law enforcement officer on the street. Frank?
Thanks, Lola. Thank you. So we've got about 9 minutes left. I think we can squeeze in 2 questions if we keep the answers fairly short. This next one is for you, Gyude. It comes from Peter Glover, who's a program officer with the Anti-Corruption and Governance Center. And I should mention, Peter is putting together a survey designed to capture what's happening in emerging markets regarding anti-corruption and COVID-19 efforts. So if you would like to take part in that survey, please feel free to drop us a line at acgc@cipe.org. So Peter asks to Gyude, in the long run, do you see any opportunities for improving accountability coming out of the COVID-19 crisis? For example, do you think there will be stronger calls for e-government platforms in Africa? That's to you, Gyude.
Well, I think yes. I think the answer to that question is yes, and I think it's going to be in 2 ways. So one of the things that we've seen emerged all over the world, I think 106 countries have actually expanded or created, as in cash transfer for social protection payments. And most of those cash transfers are going digital, are going with mobile money payment. And because those transfers are digital, it means auditing them and accountability will be easier than it would be if we're paying with cash. So I think that because people are being encouraged, we're trying to encourage people not to hold on to cash because supposedly the virus can stay onto cash. And by moving transactions, more and more transactions to mobile money and that, the number of things that will happen. One is that the more mobile money we use and the more expanded it becomes in society, we can increase financial inclusion, but it also helps with accountability of programs too. And the second thing also is that by forcing government services online, we saw that in Kenya, some judges are now conducting their trials online. By moving some of these things online where they're recorded, where there's a public record for what's happening, I think in the long run, there will be some definite benefits to transparency because of this. I mean, obviously, we would have liked to get those benefits without having to go through a crisis, but unfortunately, this is the way they're coming, and I'm pretty sure that we will be able to see some long-term benefits, yes.
Thanks, Gyude. I'll move on to our last question, which doesn't really have anything to do with anti-corruption per se, but touches on some of the themes that CIPE as an organization tackles on the continent. I'll give this to both of you, starting with you, Lola, and if you could just answer very briefly since we're coming down the home stretch. So the question, again from Hanan, is Chinese billionaire Jack Ma recently donated test kits to several African nations. I'm interested in hearing your thoughts about this gesture. Do you assess this to be power politics? And what are the atmospherics this garners with Chinese versus Western influence assistance in Africa? Obviously, that's a huge question, but if we could try to answer it in a minute or two, that'd be great. Thanks.
Yes, I'll try to. So I think that's a tough one to kind of answer because in terms of the atmospherics, so it's very controversial in a lot of the countries, at least. One thing I don't think I'm seeing is Jack Ma being equated to Chinese government. I'm not seeing that. I'm not hearing that. I think he has built a separate, identity for himself, an independent identity of the Chinese government. And so the outcry against the recent occurrences in China, the concerns about capital coming in from China that has less transparency and accountability, mechanisms attached to it. All of those don't seem to be equated with what Jack Ma has done. So I don't think I'll lump those two together. On the question about, the how Chinese versus Western influence or assistance in Africa will be perceived, that's left to be seen. What I see in Nigeria, at least on social media right now, is a lot of displeasure with the fact that 10 Chinese doctors were allowed to come and help the COVID-19 relief efforts. There's a lot of displeasure also with what happened in Guangzhou recently, and so there is that sort of public outcry. What will happen towards the end of this pandemic is not yet clear. Public opinion is not something that we can speculate about right now. But what is important is at least CIPE is looking carefully about the authoritarian connections between funds coming from regimes, some of them like China, where there is very little opportunity for transparency or accountability in how those funds are used in the country. We've been looking at that in the countries that they come to, and that will be something that I hope African countries would learn from after the pandemic, not only with regards to funds coming from China, but funds coming from anywhere else in the world to assist with infrastructure development in Africa that really undermines, governance systems of scrutiny and transparency. I hope that those will change, going forward after the pandemic.
Thanks, Lola. Gyude, if you don't mind sort of a lightning.
Yeah, just really quickly. I think, look, if you're sick in Guinea-Bissau, you're sick in Chad, and the test kit that is being used on you is something that was brought by Jack Ma or brought by WHO, who cares? Right? I think so for the average person, if they get a test kit, if they get something that actually helps their physical condition in the illness, doesn't matter. I think in the long term, I think there has been some sort of rupture to the relationship between Africa and China without happening in Guangzhou. At the moment, I think both African and Chinese politicians will move away from that as quickly as possible because of this outbreak. Africa is going to need as much help as it can get. But in terms of the African private citizens who saw this, I think in the long term, it's going to have a negative impact there. And like Lola said, I think Jack Ma, because before this, Jack Ma, for the last 2 years, has done this entrepreneurship pitch competition where he gives, and he's been moving into Africa, trying to do more on the business side in Rwanda and Ethiopia. So he's managed to build an identity for himself on a continent that is separate from China or the Chinese Communist Party. And also with this, I don't think there's some sort of conflation between what he's doing and what the Chinese government itself is doing. But again, these are just my opinions, and Frank and Lola, everybody, thank you for having me on here today.
Gyude, thank you. And I'd like, in the interest of wrapping up on time, we'll close this out. Now, a big thank you to Lola and Gyude for taking part, for giving us their time, especially Lola. I know it's the evening in Lagos, and giving us a window into the extraordinary experiences and sources of information that you have access to, and that I hope will continue to guide our programming. As I mentioned before, if you'd like to stay up to date on this COVID-19 and corruption series, we'll be continuing the discussion through these online events, through podcasts and blogs, through our WhatsApp channel devoted to the issue. Just drop us a line at acgc@cipe.org. We had about 80 people at different points in time over the course of the last 90 minutes, people from as far away as Islamabad and Jakarta. Thank you all for your wonderful questions, for taking part, and for the support that you're providing as we tackle COVID-19. Thanks, everybody.
Thank you, everyone, and thank you, Frank.
Guys, thank you very, very much for everybody. Thank you.